Hello, everyone. I am Myada. Welcome back to my channel. Climate change is already reshaping our planet, and its impacts on health are becoming more urgent every day. But while we've made strides in understanding some of these challenges, significant research gaps remain. In today's video, we'll explore the key areas in climate change and health where more research is desperately needed. We know climate change is impacting health, but there are still gaps in understanding the full extent of these effects. Research has shown links between climate and certain diseases, but more data is needed to identify the subtle, long-term effects of climate change on mental health, chronic diseases, and vulnerable populations. A deeper understanding will help policymakers design better interventions. Our healthcare systems are not yet fully prepared to face the increasing burden of climate-related health emergencies. From heat waves to disease outbreaks, hospitals and clinics are struggling to adapt. There's a pressing need for research into how we can build climate-resilient health systems that can continue functioning during extreme events, ensuring care for the most vulnerable populations. Climate change disproportionately affects the most vulnerable populations, including the elderly, children, those living in poverty, and communities in low-income countries. But there's a major gap in research on how these different groups experience climate-related health risks. Research needs to focus on tailored interventions to protect those who are most at risk and how to bridge inequities in healthcare access. One of the biggest challenges researchers face is predicting future health outcomes linked to climate change. We need better predictive models that integrate climate data with health data. This will allow us to anticipate disease outbreaks, food and water shortages, and heat-related illnesses, so we can proactively prepare and adapt. Climate change is altering ecosystems and bringing humans into closer contact with animals, increasing the risk of zoonotic diseases, diseases that jump from animals to humans. Research is still needed to fully understand how climate change is contributing to the spread of diseases like malaria, dengue, and new pathogens. Identifying how these diseases will shift in a warming world is crucial for developing effective response strategies. While much of the focus has been on infectious diseases, the connection between climate change and chronic conditions is an underexplored area. Rising temperatures, air pollution, and changing lifestyles due to climate impacts are worsening conditions like asthma, cardiovascular diseases, and diabetes. More research is needed to understand how climate change exacerbates these diseases and what mitigation strategies can be developed to improve patient care. With climate change causing extreme weather events like droughts and floods, food security and access to clean water are increasingly under threat. Research is needed on how climate change affects agricultural productivity, food distribution, and nutrition, especially in low-resource settings. Ensuring that communities can maintain access to nutritious food and safe water despite a changing climate is critical for global health. Communities are developing innovative ways to adapt to climate change, but many of these local solutions go undocumented and under-researched. There is a significant gap in studying community-led approaches to healthcare adaptation. By learning from these grassroots initiatives, we can scale effective interventions that meet the specific needs of populations facing different climate risks. Another key area for research is how we can make healthcare itself more sustainable. Hospitals and clinics generate a significant carbon footprint, yet there's still limited research on how to transition healthcare systems to greener energy and sustainable practices without compromising patient care. This is a critical gap if we're to reduce the overall impact of the healthcare sector on the environment. Climate change is the most pressing health challenge of our time, and medical research is essential to mitigating its effects. But to effectively protect global health, we need to fill these critical research gaps. Whether you're a researcher, a student, or a healthcare professional, your work can make a difference in tackling these challenges head-on. Together, we can close the research gaps and protect the health of our planet and its people. Thanks for watching.